For our family, Will was very much part of the decision-making process. He was I think a lot depends for families on the age, developmental abilities. Will is a nonverbal communicator, but he has a system of communicating, and he cognitively understands everything he experiences. So it was really important for us to have some kind of really big conversations with him at the age of 13 and help him understand how it would impact his school year, that he would miss school, that the recovery time may be a while, and it was important for him to be part of that process.
He was able to participate in the decision, and that's good, but I think it brings up another conundrum, which is that if you have a child who is of a very young age developmentally or just chronologically very young, there's some point at which the families have trouble deciding whether to tell the child what they're about to go through. So in the ideal situation, you can explain to the child what's coming up and all the things that are going to happen, and the anticipatory part of that is all useful. At some other age or stage of development, telling them that this is all going to happen just causes them to freak out. It would be interesting to know from families whether they thought that they made the right decision in terms of trying to tell their child and work through with their child what was going to happen, or whether they wished that they'd just sprung it on them as a surprise. But have you had any discussions with families to that effect?
Yeah, I do know families that often will not tell their child ahead of time if they're going to be going into the hospital, just because there is so much past anxiety around the hospital experience. And I think that that's what the richness that families bring to the table is knowing the past experiences of their child and what went well and what didn't go well, and trying to customize their approach based on knowing their child and their levels of coping and understanding.
I think one thing that can be very difficult in this for the kids that can articulate their thoughts and perceptions and feelings about it is seeing their disappointment sometimes when the surgeries have to be delayed or moved out. You know, as we talked about, there's so many active health issues that children with medical complexity have on an ongoing basis. And finding a window of time when nothing else is active and they're just hanging out ready for surgery in a very calm health state can be pretty rare.
And having the hospital have the availability necessarily to take them on. To
accommodate them. Yeah. That's exactly right. So pneumonia, 2 weeks before surgery, worsening seizures, major GI dysmotility and reflux or constipation. I mean, the list just goes on and on. If any of that stuff sort of happens near surgery and you consider, well, in the context of that, it's better to delay and you push it off, and then that can be really difficult because they're prepared for it, they're ready to go, and then, sorry, you have to wait. It can be difficult.